Hello, everyone. My name is Denzel Henderson, and I'm a sophomore. My major is exercise science, and I'm hoping to use my degree to get a job in either physical therapy or personal training.
And I'm Marissa Woods. I'm a sophomore. I'm double majoring in exercise science and dance, and I hope to go to grad school for PT.
In our video, we're going to be informing you about the endocrine system and telling you about the different components that make it up, as well as general functions of each of these individual parts, some diseases that affect these parts of the system, and the benefits that exercise has on each of these diseases. So what exactly makes up the endocrine system, one might ask? The endocrine system is composed of 8 different parts, and these parts are all illustrated in the picture to the right, as well as where they are located in the body. These parts include the hypothalamus, which is located in the brain, the pituitary gland, which is located next to the hypothalamus, the thyroid, which is located in the throat region, the parathyroids, which are located on the outside of the thyroid, the adrenal glands that can be found in the upper middle abdomen area, the pineal gland, which is also located in the brain, the reproductive glands, which are known as the ovaries and testes, which are located in the pelvic region, and the pancreas, which lies right behind the stomach. As you can see, the endocrine system is a complex system that ranges throughout the entire upper half of the body. All of these components perform specific tasks that help our body maintain proper functioning. So, in a nutshell, here's what each component does in the endocrine system. The hypothalamus acts on the pituitary gland as a stimulus to start the release of the ACTH hormone in the body. The pituitary gland helps to control the levels of water and electrolytes throughout the body, and this is very important for staying hydrated adequately. The thyroid is responsible for controlling cell metabolic processes in all cell types, while the parathyroid, on the other hand, has a special task of controlling metabolism of calcium. The adrenal complex protects the body against stress, as well as to help regulate carbs, protein, and lipid metabolism. The pineal body produces melatonin, and this is very important in influencing sexual development as well as the sleep-wake cycles. The testes are the reproductive organ that produce sperm, and the ovaries are the reproductive female organ that produce eggs, and these are both essential for reproduction. And lastly, the pancreas is responsible for breaking down sugars and controlling blood sugar levels. An issue in any of these individual structures will affect every component because they function all together as a system.
All right, did you know one of the most growing diseases in America today would be diabetes? In the United States, nearly 17 million reported cases of diabetes. This is because more than 50% of Americans do not get at least 30 minutes of exercise per day. There was a survey done by the National Health and Nutrition Examination, which reported that 31% have no physical activity and 38% have less than what's recommended. There are 2 types of diabetes, type 1 and type 2. Pretty easy to remember. Type 1 diabetes is where the body stops making insulin, and type 2 diabetes is where the pancreas makes insulin, but insulin cannot be used properly or it may not make enough. Without insulin, you do not have what you need to provide your cells with enough energy. A good way to remember this is that glucose plus insulin equals energy for the body cells. The bad news about diabetes is that there's no cure. Good news is that exercise and dieting can help. Exercise and a healthy diet can sometimes be enough to control type 2. Physical activity can help exercise insulin in the body and be used more effectively. This also helps weight maintenance and weight loss. What exercise does? Regular physical activity can reduce cardiovascular risk by lowering blood pressure, improving lipid profile, and reducing body weight and percentage of body fat. This is not only good for a diabetic, but also anyone in general.
Polycystic ovary syndrome is something that many women may struggle with. and it's a syndrome that comes with a number of different issues. These can range from irregular menstruation, infertility, insulin resistance, and weight gain or obesity. There are three criteria that women must meet at minimum to be diagnosed with polycystic ovary syndrome. And the first one is that she has to be showing menstruation irregularities. The second one is that there needs to be evidence of high levels of the male hormone androgen. And the third requirement is that there cannot be another disease that she has with similar symptoms. This is so that the diagnosis is correct as possible and so that it may not overlap with something else and be falsely diagnosed. Since there is such a wide range of symptoms that come along with this, like I said, it can often be tough to initially know for sure if the diagnosis for polycystic ovary syndrome is correct. So in order to take a further look, biochemical testing can actually not be done, but you can have an ultrasound done, and the ultrasound can show you actual cysts outside of the ovaries, as well as other testing to check for certain amounts of hormones present from the different parts of the endocrine system. Exercise affects this because obesity is a complication directly of polycystic ovary syndrome. So with obesity being an issue, exercise has definitely been proven to be one of the better health modifiers for people who struggle with obesity. Also, with menstruation being an issue, working out on a regular helps to promote a normal period.
All right, another disease affected by the endocrine system is osteoporosis. It's a Latin term which means holes in the bones. It's a skeletal disease caused by low bone mineral density. There's the structural deterioration of bone is bone weakness and increased risk of fractures. The picture shows that what normal bones should look like and what someone with osteoporosis looks like. What puts you at risk? One of the reasons women are more susceptible to osteoporosis is because after menopause, they lose estrogen protectiveness. Other factors include use of tobacco and alcohol, not enough calcium, diabetes, and anorexia and bulimia. The picture kind of shows what could happen to a woman over time. I don't know about any of you ladies, but I would like to avoid this happening as I get older. So here are ways to hopefully prevent this from happening. Exercise, of course. When exercising, you should probably do high-intensity workout because those are better at increasing bone mineral density. There's also a recommendation to put more calcium in your diet, which you can usually get by obtaining 3 cups of milk. Calcium-rich foods such as broccoli, almonds, and yogurt.
Pancreatitis is another disease that is actually a disease of the pancreas, and this is the inflammation of the pancreas which causes severe abdominal pain. Many cases of pancreatitis are associated with excessive alcohol or glucose levels that are found in the pancreas. But since only 5 to 10% of heavy drinkers develop pancreatitis, there is believed to be some genetic and nutritional factors that may be the cause as well. There are 2 different types of pancreatitis, acute and chronic. Here's a picture of a guy with pancreatitis, and basically the pancreas is inflamed and is sticking out, and it's very, very nasty. So in acute pancreatitis, the pancreas suddenly becomes inflamed, but then gets better. This is the most common type of pancreatitis, and it only takes one of these episodes in order to get you to the other type of pancreatitis that we're going to talk about, which is chronic. And this is when the pancreas becomes actually permanently damaged and unable to supply a sufficient amount of hormones and digestive juices throughout the digestive system. If pancreatitis occurs during pregnancy, there's actually a 20% mortality rate for the mother during pregnancy. The chronic form of pancreatitis takes time to onset, but like I said, it can develop after just one really bad episode of an acute inflammation. For drinkers who have quit drinking, even they can be affected by pancreatitis. It may set in after several years. The benefits of exercise for someone with pancreatitis is that it helps to maintain optimal functioning, which means a better working pancreas. The pancreas is responsible for controlling glucose levels in the body. So if the glucose cannot be controlled, then acute pancreatitis may occur. There was a study done in which a woman was trying to get pregnant and did not want to risk pancreatitis during her pregnancy because of her high glucose levels that she had been told about during testing prior to wanting to conceive. She was actually prescribed just exercise and diet, and after 4 months, her sugar levels came down to where they needed to be in order to carry out a healthy pregnancy. And this allowed her to give birth to a baby without having to worry about complications for the two of them.
All right, here's ways to get started for people who do not exercise regularly. Start taking steps. Doing household chores, gardening, taking walks. Just basically start an active lifestyle. For those of you who are active, they recommend at least 30 minutes a day, 3 to 5 times a week. Thank you for listening to our presentation.